over to you. Oh, and thank you. We are recording so we can post the video later on our YouTube channel. And we will post the different languages as well. Thank you, Allison, for remembering to hit record. And now I'll actually hand it over to the Health Connector team.
Great. Thank you so much, everyone. And thank you for taking time out of, we know what are your very, very busy days to hear this important information from us. I'm Nikki Conti, the Director of Outreach and Education at the Health Connector, and I'm here today with my colleague, Jonathan, who is the Director of the Health Connector for Business program. And I see some other colleagues too. I believe my colleague Nelson is here, as well as my colleague, Thalia. They're going to be helping us today as we go through this presentation. As mentioned, this information, you'll be getting a copy of these slides, and this information is going to be available to you in other languages. But we will do our best to go through this information slowly today. We're here to answer any questions that you might have. And if today is not the day, if you think about something later, certainly we'll provide contact information so you can reach out and get your questions answered. Jonathan, before I start with the deck, is there anything else you'd like to share?
No, I think that's pretty much it. I just want to say thank you for having me today, and I look forward to kind of, talking through this presentation and answering any of your questions that you may have.
Great. So as I mentioned, or as was mentioned, we work for the state's Health Connector. So we're the state's health insurance marketplace. Today, we're going to specifically be spending time on Health Connector for Business. We'll talk about our organization, then talk about our offerings for small employers. We'll go through details of getting started with the process, different ways that you may be able to save money when shopping for coverage for your childcare organization. We'll talk about choices and also some other available savings programs. One is our state's ConnectWell program, and the other is the federal healthcare tax credit. During this presentation, my colleague Jonathan is going to spend some time showing you some tools that we have available for free. They're fairly easy and quick to use, so you can get a sense based on your specific business that you run, what Health Connector for Business plans could look like if you're providing them to you and your staff. And then, of course, at the end, we know some of you may be a very small, maybe just a very small childcare organization, and maybe it's just you and a family member that are providing the childcare support. So I'll talk to you about Health Connector for individuals and families, which essentially are for sole proprietors or an owner-only company. All right. So I'll start off with who the Health Connector is, so you have some familiarity, context. We are the state's health insurance marketplace. A lot of people think of the Health Connector and combine it with Mass Health. Understandable, but important to note that the Health Connector and Mass Health are separate entities, separate agencies, and have different health insurance offerings. So the Health Connector is here to provide access to affordable coverage to individuals, families, and small employers of Massachusetts. We're really here for those who don't have health insurance through a job or another source. And a lot of people that come through the Health Connector's doors who apply for coverage also qualify for help. People can also get dental insurance through the Health Connector. And where we're going to really focus our time today is on Health Connector for Business. So this is where small employers who have 50 or fewer full-time employees can offer health and dental plans. Now, I'm going to get to the slide that I'm not going to read this to you because you don't need to know all this health insurance speak. But at a super high level, here's what you need to know when you are shopping for coverage through the Health Connector. All of the plans that anyone enrolls in through the Health Connector, whether you're an individual, a family, or a small business, you can rest assured that these are comprehensive plans. They meet state and federal requirements, and they're known as qualified health or qualified dental plans. Now, on the individual and family side, those folks can qualify for federal premium tax credits if, in fact, they meet certain qualifications. And those federal tax credits essentially help the consumer just pay less each month for coverage. We also have connector care plans, which we'll be talking about later, and it's really for individuals who are in lower income ranges. And the connector care program takes state dollars plus those federal tax credits, combines them together, and that's how the individual sees savings, as well as through the plan designs. The plan designs really provide comprehensive coverage with low cost to the member. We also have catastrophic plans for people who are under 30 or who meet other exceptions. We have dental plans. And really, again, we're here for Health Connector for Business. So who offers these plans? Who are, which carriers are working with us? So we're very proud to say that most of the Massachusetts leading insurers are offering coverage through the state's marketplace. So as you look at each of these logos, we're hoping that these are health insurance plans that you are familiar with in your community. And essentially, because you're shopping through the Health Connector, you're going to have an opportunity for cost savings, because with Health Connector for Business, there are flexible plan choices that you can take advantage of. Now, this is really the heart of Health Connector for Business. So we're really here we're really trying to make providing health insurance for small employers available. We're trying to maximize access to this coverage, trying to create more affordable plans for small employers. And again, it's really through a lot of different dimensions that we're able to do this and provide flexibility to both the employer and the employee, giving you choice and also opportunities for savings. So I'm just going to kind of go around the circle for a moment and just reiterate, we have full carrier participation. So what does that mean? Leading carriers in Massachusetts participate in Health Connector for Business. We have competitive premiums. So we'll talk about this in a little bit, but basically employers who take advantage of Health Connector for Business plans can save over 20% on average before any rebates. And that's because people are able to choose between plans and different plan designs so that they're able to save some money. We have wellness rebates, and this is specific to Massachusetts through our state's ConnectWell program. We'll talk about that. And I alluded to this a little bit, which is flexible employee choice. So I'll stop using these terms and you'll see what these mean. But also know that there is free help available to all of you. We know how busy all of you are. I'm actually so grateful that so many of you are taking time out of your day to come to this webinar and learn about these offerings, but want everyone to know that there's free help available through Massachusetts licensed brokers. There are over 500 certified brokers who can help you with Health Connector for Business offerings. So that will save you time. And all of these things together, we're hoping offer you peace of mind. Not only peace of mind as you're going through the shopping process, but peace of mind as you're talking to your employees and explaining that you're able to provide coverage to them and they can enroll in it if they want to. Now, there is some eligibility that we need to keep in mind. So in order to offer coverage through Health Connector for Business, you must meet certain requirements. You need to be a small employer. You need to be employing one to no more than 50 full-time equivalent employees, and there needs to be at least one non-owner, non-family member enrolled as an employee. And as I said before, don't forget, if you are a family business, we have options for you, but you won't be able to get that coverage through Health Connector for Business, but we do have options for you. Now, the employer's physical address has to be in Massachusetts. Not to worry if you have staff who live outside of Massachusetts. However, the business needs to be a Massachusetts business. Now, in order to activate the group's coverage, the group has to have at least 75% of employees participating. But what that means is they're acknowledging they're either waiving coverage or they're enrolling into coverage. And the employer, you, are submitting the initial binder payment. And that is usually due on the 23rd of the month that you want to enroll in prior to the next month. We'll spend some time talking about that as well. All right. How am I doing for pace?
Be good. Yeah.
Good for the translators? Okay, good.
Yeah,
Just want to make
Nikki, if I can just real quick on the eligibility piece, just to let
sure.
everyone know, the 1 to 50, as long as you come in under 50 employees, if you are a group that maybe has like 46, 47, and you're concerned about, well, what happens, if I bring some more employees on and I go over that 50, you are able to stay on with the Health Connected for Business as long as you are under that 50 when you come in, and you're able to stay on with us until you hit the 100 employee mark. We do have a few groups that are, within like that have 75, 80 employees to their groups. So I just want to give everyone a quick heads up on that as well.
Thank you so much, Jonathan. And if there's anything else you want to add as I'm going, please don't hesitate. Just stop me, jump right in.
Thank
Great. So in terms of peace of mind, we were talking about this a bit. And again, just want to reiterate that all of our plans are compliant. We meet state and federal coverage requirements. Every year, our Health Connector board goes through what's known as a seal of approval process. And essentially what that means is our board, members of our staff, along with staff from Department of Revenue, do a comprehensive review of all of the offerings that the carriers want to sell through the Health Connector. But in terms of, coverage standards, you just keep in mind, these are the basics. There's office visits, emergency, hospitalization, pediatric care, prescription drugs, etc. These are all of the things that you can expect to receive if you choose to enroll through the Health Connector. Now, there are some additional benefits here that I just want to spend a little bit of time talking about because these are things that other small businesses, other owners have asked for and essentially have become available to Health Connector for Business. So we have plans that are compliant with health savings account. So if these health insurance terms are somewhat new to all of you, I just want to acknowledge that health savings accounts, or you've maybe heard of them as HSAs, they're basically accounts that can be set up that allow individuals or small businesses, employers to take advantage of paying for coverage using pre-tax dollars. So right now, every carrier that through our shelf offers at least one plan at a silver level, which is compatible to use for an HSA plan. And if I'm not mistaken, we may in 2026 have at least two, but we will get back to confirm that. Now, in terms of out-of-state coverage, remember the business needs to be a Massachusetts business, but we do offer out-of-state coverage with new preferred provider organization plans. So these are PPO plans, but employers will need to offer the one carrier model, and we'll explain that, what that is. And then new for this year, we are providing flags as you're going through the shopping experience and you're looking at plans. And basically, this is essentially certain plans are being flagged to basically identify that they have a lower than market average premium. So if you're really price conscious as you're going through this process, we suggest that start there and look at that premium value plan. Okay. Now, there are a couple of things that I've mentioned already that I want to be sure to just provide a little bit more detail on. This process, if you are interested in
I
purchasing
don't know, guys, loving it, but Ezra's like,
Okay, if you are interested in purchasing a Health Connector for Business plan, or even a plan for individuals and families, I think what we want to convey, is important to know, is you can do all of this on your own. We have a website, we'll be providing that information to you. You can go to the site, you can shop for a plan, and if you decided this is something that, yes, you're interested in, you want to enroll in, you can begin that process. But there is going to be a point in which you have to enter your employer's information. And then your employer is going to need to shop for a plan. So you have your deadline, which is you shop for the plan, the structure, etc., by the 10th of each month. Then you give your employees 10 days to make their decisions. And then any payment that is due is going to be due on the 23rd of the month. Now, really important for you to know is that with Health Connector for Business, there's no open or closed enrollment. You can choose to enroll in a Health Connector for Business plan at any time during the year. Although it is important to note that there are times during the year that that seem to be more active for us. And that's typically the start of the new year. So enrollment for January 1 or enrollment in the spring. So traditionally, small businesses enroll in coverage in March and April. Now, I mentioned that you can do all of this on your own, but we do have free assistance available to us through Health Connector for Business insurance brokers. There are over 500. We have a link where you can find a broker. They will do things for you so that again, just to save you some time. They will do the cost estimating for you. They can talk to you and also your employees about understanding the plan options so that as you're comparing and you think about your current group of employees, you are understanding and really being able to choose the plan and the structure that's going to be best for your staff, for you, your staff, etc. Now, I think the most important thing here is they really do allow you to save time. So they'll help manage this process for you and also work with you year after year. Now, I want to spend some time talking about the employee choice models. I referred to this earlier. And I think this is really where you're going to see how you as an employer will be able to, maybe create some savings for yourselves and your employees, but also provide options to your employees that are going to best meet their needs. So we have a couple of different plan designs. There is essentially the typical way that small businesses offer coverage, and that is through one plan. So the employer, does their shopping either with or without a broker. They select one plan, and then all employees who need to enroll in coverage choose to enroll in that plan. This is using composite billing method. And if you want to offer a bronze plan, this is the only model in which you can choose the bronze plan and have your employees enroll into it. Now, this is where we start some variation, and this is where you can see where the choice, and also if you as an employer, you think about your staff and their different ages, they have different health needs. This is really where they become appreciative of the offering. This is a model where you select one carrier and you can choose, you select one carrier, but then the employee can choose a plan at a different metallic level offered by that carrier. So this is a list billing method, and we have PPO options available. But if you can imagine, you might have employees who have higher health insurance needs, and they say, great, I would like to buy up and I want the more expensive plan. You as the employer are still contributing a set amount. They are just choosing to enroll in the higher plan because perhaps that has a broader network. It's going to meet their needs. Now, this is another option, again, unique to the Health Connector for Business, where we're able to say one level. And this is where you, the employer, select a metal level and you choose a reference plan, and that becomes your benchmark. That's how we determine the cost of what you're contributing. And you might say, you know what, I'm going to offer all gold metal level plans or silver. But my employees, have different needs. So someone might be more drawn to going with carrier X, and another person might be more drawn to going to carrier Y. Again, you as the employee, you're just choosing the level of the plan. You're choosing what you're contributing, the cost, that's fixed, but people are going into the carrier that is going to better meet their needs. Now, I want to spend a little bit of time talking about ConnectWell, and this is a program where employers can get up to 15% of their contribution towards premiums back if 33% of the employees participate in a wellness activity. So as we looked back on last year, the average rebate was almost $5,000, so $47.90. So we know employers are really, really happy about this opportunity for additional savings. And I really think it's important to understand that employees, they get into it, there's incentive there for them. If they participate in ConnectWell, they get a $100 gift card. And truthfully, the wellness activities, they're organized into 3 buckets. There's mind, body, or money activities. And you can see the different qualifying activities in each of these areas. But essentially, once an employer is offering or says that they want to enroll in ConnectWell, the employees just have to provide proof of that activity that they did. And then, they'll get their gift card. And then once we've reached that percentage point at the end of the calendar year, the employer will get the rebate. And Jonathan, I know I left out a whole lot of detail, but I think you can give, if you want to provide more now, or you can give more during Q&A, that would be great. And now I just want to talk a little bit about the small business healthcare tax credit. So the Health Connector does not administer this program. However, we like to promote it because this is a federal program where small businesses could be eligible for up to a 50% tax credit. And depending, again, you can see it's 50% or 35%, depending on how you're set up as a business. But you have to be enrolled in the marketplace, and in Massachusetts, that's through the Health Connector, through Health Connector for Business. You have to cover at least 50% of the cost of a single healthcare coverage plan, and then have fewer than 25 full-time equivalent employees whose average wage is less than $62,000. Now, I know we're providing you with older rates, There, unfortunately, this hasn't been updated in some time, but we like to just say that this is an opportunity that is available essentially to certain types of employers. And we recommend that you talk to your accountant, whoever essentially handles your payroll and taxes at the end of the year, because this is a really great benefit for certain small employers. And we've provided you with the link to the IRS landing page that has more information about this offering.
And Nikki, I can't update for this one. I know if you go to the web page, it is still showing rates for 2023. So the average wage has to be less than 62. I believe right now that average wage is 67,000.
All right, perfect. It's just a matter of, unfortunately, that it's not published on their site yet. However, really speak to your accountants. They will know. They will know, and they can help you with this credit if you think you might be in a position to take advantage of it. All right. So now I'm going to get ready to hand this over to my colleague Jonathan to show you, our tools, do some live demonstrations. But before I share or I stop sharing slides, I just want to talk a little bit about, maybe a couple of scenarios that hopefully feel familiar to you, where we have, first we have Sophia. She runs a family childcare program, and she's looking for an affordable option to cover a caregiver who has dependents and staff who may have more healthcare needs. So in this situation, you might be thinking, all right, here is someone, she's got 2 assistants, she knows one has a chronic illness, and we know another assistant has 2 young children. Okay, so we need to think, all right, that could be a certain type of Health Connect of her business plan and structure that Sophia wants to shop for. Now we have another type here that Maria runs, and this is a small center-based childcare program, and she's looking for coverage options that are going to work for her team, and they're a little bit different than Sophia. So Maria's program has 3 lead teachers. She has 6 assistant teachers. Maria is approaching her retirement age, and you could assume that, all right, Maria wants to be sure that she's got a good, solid health plan for herself as well as the staff. When she looks at her group, 4 of the teachers have young families, and 2 of the assistant teachers are recent high school graduates, so they're a little bit younger. So these are 2 different tools that you can use. Again, this is free. There's no commitment. And essentially, you can either manually add your employees' independence, or if you were Maria and you're in a situation where you have a few more employees, Jonathan's going to show you how to use a template and essentially upload that information. So Jonathan, I think I'm going to, before I stop sharing, I think I'm going to allow you to just share over me.
Yeah, no, thank you for that. I appreciate it.
Thank you.
Yeah, so this employer quick quote tool that we will be showing today does live outside of actually creating an account within our system, which is great for you to be able to go in and kind of play around with maybe, what you think employees will and won't sign up for coverage, to look at various different plans, shop and compare those plans without going through the actual process of going in, creating an account, having to submit everyone in there, and then having to put down your percentage rates in various things like that. Because then what ends up happening is you get a draft plan, which then you would have to publish. Some people will work with a broker at that point to help them kind of work through that process. But what we want to do here today is just give you that option to at least be able to use that quick quote tool to look at some of these plans and compare maybe some of your pricing costs and what you may or may not be able to afford outside of actually creating that account. So if you want me to now, Nikki, I can share my screen and I'm going to bring you directly to the link, and I can show you the 2 different scenarios and how we would do those. Perfect. Okay, and I will ask real quick, can you see my screen, Nikki, on your end?
Yes, perfect.
Perfect. Okay, so when you do click on that link, you will be brought to a website, a landing page, which is our employee quick quote. Within this employee quick quote, you would essentially look at your business and you would input some of this information into the various different fields that pertain to you, and it will spit out a lot of different numbers and plans that you can potentially choose on your end. When you look up here, you're going to see employer information. It's going to ask you essentially, when do you want to shop for coverage? You can shop up to 2 months out. So right now you could shop up into December right now. You're going to put in your SIC code. You may not know exactly what your SIC code is, but what you can do is usually if you put in the type of business that you have, it will tell you what your SIC code is. I usually use Google for a lot of them. I did one for the early childhood education, for child daycare services and early education, and the SIC code that does come out is 8351. So that should pertain to your group. If you put in the wrong code, it's not the end of the world. You can still move forward with that. You're gonna put in your business zip code, you're gonna put in your county, and then down here you're gonna see there's various different options for input in your employee roster. One of them being upload an employee roster or just add in them manually. So for the first scenario that we had for, I believe it was Sophia, I went ahead and I created, just so we can kind of skip me actually manually putting in everyone, putting in someone, putting in this employer. So what you would do is when you put in the first employee, so in this one I included the employer. You will want to include yourself as the employer in this list. Even if you don't want to offer coverage for yourself, you can still waive if you get your coverage elsewhere, or if you get it through a spouse or anything like that. And the same thing with your employees. This tool is best used if you just put in as much as you can information wise that you think people are going to sign up for. So even if someone doesn't sign up for something, you have to offer to everyone. So there is a possibility that maybe, their situation changes and they might need to offer, get onto the coverage that you offer. So it's good to just get what that maximum amount is going to be. So it's best to have as much information as you can for this roster. So for this one, for the first scenario, I put in Sophia as the employer. I put in her first employee with a date of birth, and then you can choose the coverage type. And then for her last employee, I put in the regular employee, first name, last name, date of birth. I chose coverage as both, but like I said, you can go in here and choose whether or not you just want to offer health or if you want to offer dental. And then underneath the employee, you'll see there's this add dependent. And that is where you can add any children, any spouses. When you go to put those dependents in underneath relationship, you can choose whether it's a spouse, domestic partner, or child. From that point, all you have to do after that point is click Save Roster. When you do that, it's going to kind of bring you up a summary of what you just submitted. So for this one, we have Sophia as the employer, no dependents, the first employee, no dependents, and then the second employee, 2 dependents. And then from there, if you made a mistake, you can go back and add an employee over here in the left-hand corner, or you can go to View Plans to go to the next step. So when you go to View Plans, you want to click on what benefit model that you want to use. So you can see that if I click on different plans, it will change this grid down here. So for the one carrier and the one level, as we had kind of talked before, that is based off of a list billing method, which means that each individual is going to be charged a different rate depending on their age and their geography. So you will see when you look at the plan summary, you're going to see a plan name and summary, a benefit cost, which is going to give you, your hospital stays, emergency stays. It's going to let you know what the annual deductible is for individual and family. It's going to give you your out-of-pocket costs. And then as an employer looking at this, this number is probably the most important that you're looking at. This is going to be the employer's cost. Now, one caveat to this when we show these prices is that this cost right here on the quick quote is based off of a 100% employer contribution rate. As an employer, you need to at least offer 50%. So this number will be drastically lower when you actually go into to create an account and you actually go in and you shop plans. But this would be if you decided, hey, you know what, I want to cover 100% of my employees' costs for health insurance and not split the cost. This is what it would be to cover that entire group monthly. And then at the 50%, you would take half of that and you would be around $700 a month. That would be the employer's responsibility. And then the other responsibility would be on the employees to pay their portion. When you do the billing, it is on you to take that. So you are the one that pays the bill, but you would take that money out of the employee's paycheck each pay period to cover that cost. One level, you're going to see the same thing here. The employer cost does not change for 100%. But when we go to one plan, you're going to see that there's a little bit of a breakdown. So it's actually a little bit cheaper for the employer cost. And that's because with the one plan, we do a composite billing method where they actually take the entire group and they take an average premium rate. So if you have some older individuals, if you have some younger individuals, it's going to kind of meet in the middle of what that rate is actually going to be. And over on this column right here, you're going to see monthly cost. That is what the monthly cost is for each breakdown. So if it's just an employee looking for coverage under this one plan, this would be their premium amount. And like I said, that's at 100%. So you would be responsible for at least 50% of that at the minimum amount that you would have to contribute. For an employee and spouse, you would see this amount. For employee and children, you would see a different amount, and then for family. And then what this is up here with your maximum monthly is it takes everyone into account and it just lumps them together and it says that this would be if you offered 100% across the board, this would be your maximum monthly that you would have to pay monthly. A few things when we look at this that I like using for tools, there is a Find My Doctor tool link that you can click on. And what this does is when you click on it, you can actually find various providers. So you would put in your zip code, you put in a provider name, you would choose a specialty and you would choose a company, and then you can find your providers. I did on my end.
Jonathan, could I
Yes,
you to hold on one moment?
absolutely.
We just got a note that I think I know you were sharing your screen before.
I think folks can see it now. I think if you do minimize the slides, sometimes you can just see the speaker, but not the slides. So folks can see it. So we're okay to go forward.
Okay, perfect. Keep
Yeah.
going.
Okay, perfect. So what I was going to say was I already put one in here without a provider name, but you can see, it will show you that, various providers found within a certain distance, a certain radius of the zip code that you put in. And then it will show you which plans and providers that they actually accept. So if you will look in, you wanted to do yourself and your family and then offer certain plans because you knew your employees were looking for specific things, you could kind of look this way. And then it's good on the employees' end as well when they're shopping, especially with those models that allow you to shop up or down or across carriers. You can make sure that you get doctors that are within your network. You can also look by facilities as well, and it will do the same thing. It will let you know if a facility is covered under specific plans. And then the next one that I want to do is the second scenario. And for the second scenario, what you would do is you would upload an employee roster. When you click upload an employee roster, it's going to ask you to upload a file. So what you want to do first is you want to download the template. And then it will upload in your browser. You just want to open that up. One thing that I will caveat from here, and this is just going to be a blank one behind it, is when we look at this employee census template, and let me know, is this really small on your screen? Do I have to maximize into this for you?
It is pretty small. That looks a lot better.
Is that good right there?
Yes.
Perfect. Yeah, I know with Excel it gets kind of wonky sometimes. So you're going to see if you look across the top, it's going to ask you for a lot of different fields, which can be a little bit daunting. A lot of these fields are optional. So you'll see like under this first one, optional, optional, optional. If you go across optional, optional, optional. So there are a lot of fields that you don't have to fill out for this to actually get the quote that you're looking for. But what this allows you to do is if you have a bigger group, instead of doing each individual one manually, you can put everything into this template and then you can save it and then you can submit it into our website and we'll automatically spit out the different numbers that you're looking for. I went ahead in the backgrounds and I created one based off the scenario already. So you can see these are the actual fields that I had to fill out. Relationship, last name, first name, your email address, social security numbers, but only for the employees. So you don't have to do it for the dependents. You need dates of birth, the genders, date of hire, and then is it a business owner? So for this one, for Maria right here, across the board, she would be the business owner, and then everyone else would be no. And then you can see there's a lot of other columns after this, but everything is optional on the background. So after you create your template, you would save it to your computer, to a folder, to a file, wherever you would like to. And then what you are going to do is when you hit update employee roster, you want to go to browse. You will go to wherever you have your roster, and then you will update that employee roster. And what that's going to do is that's automatically going to do all the manual work for you on this end. So you don't have to go through and add each one individually. So you can see all of my different employees, all of their dependents are all added, relationships, dates of birth, and then you would just go ahead and you would save that roster. I believe on this one, I do have to pick an effective date though. 1, 5. And then the same thing will happen on this end where you will get you'll get an overview of what you submitted, confirm that that's correct. You can always go back and change it. And then you want to view your plans. And I'll click on one carrier and then you'll see the same thing here. Obviously the employer cost is the maximum monthly is going to show us a little bit more because we do have more employees and dependents on this group. One of the things that I did not actually go through that I wanted to show you as well is under all of these different summaries and benefits, we do have the benefits of coverage. So if you're wondering what is covered under certain plans, you can just click on those. It will download a PDF version and you can actually look at, it explains out of pocket limit, network providers, and then it will tell you everything about preventative services, co-pays, co-insurance, and what your portion would be that you would be required to cover. And then just the last one on here, you are able to filter as well through these plans. So if you know that you're looking for specific plans, you can click on filter and then you can pick a metal level, you can pick a plan type, you can pick, is it at HSA eligible or not? I know a lot of people like to offer the HSA eligible one because it allows, maybe you look at a higher deductible plan, but you have an HSA to kind of cover those things. And then you can actually put in a dollar amount as well for the premiums. So you can kind of look, what's in your range and look at plans that way as well. But that is the employer quick quote tool. Like I said, you can also sign into the website and actually create an account and start this process. And it does, you can do a draft group, which does not push you forward, but it allows you to at least have everything ready. So if you decide to make a decision, you can make a decision a little bit quicker and not have to do all this work again. But we do like having this quick quote tool out here for individuals that are, they're not sure where they are in the process. They just want to get some information and what that cost might be for themselves. Yeah, I'll stop sharing my screen now.
And I'm going to reshare. So Jonathan, one thing that you said, and I feel like I try to say too, is this is no commitment, right? Like, of course, we want people to enroll in Health Connector for Business, but we want you to also know that this is a great way to Go in, compare your options, really look at the costs. And it's really your decision to take the next steps. There's no cost to you to either apply for coverage there, or this is my segue into the side of the house, which is if you're a sole proprietor, owner only, you run a small center with just family members, I'm going to talk to you about the individual and family side. So on the individual and family side, there are two ways in which people can save money on their plans. You can get access to advanced premium tax credits, and these are federal tax credits that lower the premium that you pay each month. So the money goes directly to the IRS. The money goes directly from the IRS to the insurance company. So you, as the member, simply just pay less each month. And then if you are going down this road, you're essentially estimating your income for the year. So we ask about current income as well as income for the full year. So you get to see how much tax credit you could be eligible for the benefit year based on the information you've provided to us. But you don't have to take, as an example, if you get $500 of advanced premium tax credits allotted to you, you don't have to use that full amount. You could say, you know what, the income actually fluctuates up or down. I want to be conservative. I only want to apply $300 of that advanced premium tax credit. And then separately, I earlier spoke about the Connector Care program, and this is our subsidized health insurance program that uses federal tax credits as well as state dollars to reduce the monthly premium amount. And it has lower monthly premiums, low out-of-pocket costs. There are no deductibles. So depending on your situation, if you are, again, a sole proprietor, it might just be you who provides childcare to a couple of families. You could be paying as low, you could, depending on your income, qualify for a $0 plan or a plan that's a few $100s a month. Now, just like Jonathan showed you on the business side, there is a get an estimate tool on the individual and family side that you can use when trying to figure out what your costs may be if you enroll in coverage through the Health Connector. Now, different from Health Connector for Business, the Health Connector is currently in a closed enrollment period, and that runs from November to, excuse me. Oh, I think this is a little messed up. We're currently in a closed enrollment period. So I will correct these before these slides get out to you. But essentially, up until November 1, we are in a closed enrollment period. So what that means is if somebody needs coverage right now during a closed enrollment period, they simply should be applying to see if there's a special qualifying life event that opens a special enrollment period. So we never want anyone to be in a situation who needs health insurance coverage to not have it. At the outset, I explained that the Health Connector is a different organization from Mass Health. However, it's really important for me to also explain that when you're applying as an individual or family, Mass Health and the Health Connector use the same system on the back end to determine what you qualify for. So Mass Health has different starting rules, enrollment rules, etc. So there are different dates that you need to do things by, different qualifications. So certainly want you to take advantage of any coverage that is available to you if you need health insurance coverage. Now, I'm going to try to quickly, but not too quickly, interpreters, let me know if I'm going, if this still works, this pay still works. But you need to be someone who lives in Massachusetts. You need to be a US citizen, a US national, or lawfully present in the US in order to qualify for savings through the Health Connector. And you need to be someone that doesn't have an offer of insurance. So if you're married and your spouse has an offer of health insurance coverage, we'd recommend, nope, this isn't the path for you. But if you're somebody who's enrolled in Medicare, you already have Mass Health, or you have other public health coverage, like some people have coverage through veterans benefits or their spouse's veterans benefits. And again, if somebody is offered affordable comprehensive health insurance from their employer, um, you wouldn't want to be applying for coverage. But when you're sitting down to apply for this coverage, you would want to collect your social security numbers for everyone who's applying, immigration documents for all non-US citizens who are applying if they have these documents. And then they just need to gather pay information. And the pay information really is to see if you qualify for some kind of help paying for your coverage. So you need net income from self-employment. If you get paychecks, we need copies of last 2 pay stubs. And then if for some reason you didn't file taxes the previous year, or your income has changed since last year, we would just want you to collect some proof about that information. Now, again, if somebody is seeking health insurance coverage, they don't have all of this information. We still want you to start this process. We still want you to complete the application. If you don't have all the information we need, you'll see a message on the screen asking for more information. You'll also get a letter asking for the information that's needed. Remember, it's really about making sure people have coverage. So just like Health Connector for Business, we have customer service as well as community partners that can help somebody through this process. These are not certified brokers, but these are certified application counselors. And if you call our customer service number, 877-623-6765, they can help you if you need assistance in another language. They can also use language lines interpreters to assist. And community partners. So these are our navigators or certified application counselors. And these folks are located all across Massachusetts. I think there are over like 1,500 of these individuals at this point. And depending on where you live in Massachusetts, you likely can find a certified assister who speaks your language if you need help in a language other than English. For the community partners, it's recommended you call ahead to schedule an appointment. But we're almost at the conclusion here and really looking forward to answering your questions. So want to just summarize all of this with you. So really, we want you to take away that small employers and owners that don't qualify to offer coverage through Health Connector for Business still have an option, and you can get your coverage on mahealthconnector.org by applying for and enrolling in an individual or a family plan. There are particular deadlines that you need to account for, and so you would need to apply, enroll, and pay your first premium by the 23rd of the month before your coverage can start. So right now, if you are a sole proprietor and you're thinking, all right, I've got to do this and I need my coverage that starts November 1, and I haven't, there's a reason I've lost access to coverage. So I know that I'll qualify for a special enrollment event. You just need to go through the process, complete your application, and pay by October 23rd. Now, if you are a small business owner who's with us today and you do qualify for coverage through the Health Connector for Business, we have similar deadlines on that side, but the steps are going to be different. Now, by the 10th of the month, we really need the employer to create an account. You need to upload information for all your full-time employees, quarterly wage document, and you want to publish the benefit package in an employer online account. Now, by the 20th of the month, that's the deadline for employees to create their own accounts and enroll in or waive coverage through Health Connector for Business. And then if all is moving along, this is the 23rd of the month is when employers have the deadline to make their first initial binder payment. And you can do that online in the billing payment portal. Now, I just want to pause here for a moment because Jonathan, I just want to, say like it's October, and I know that employers might be saying, okay, this was a lot of information to take in. I'd like to do this now, but maybe I don't want to start offering coverage until December, or I don't want to start offering coverage until January. Do you have any recommendation, advice for people about, just going through this process early and getting themselves kind of situated and prepared to enroll for a future date?
Yeah, I mean, I think the best thing to do is to start early, right? Like we said, you can start shopping up to 2 months prior to the date that you want to effectuate coverage. Um, for November is a little bit trickier for January shopping, only because we have to wait until November until new rates are out. However, what I will say is, do the research, utilize the quoting tools, but also utilize if you do sign up, use a broker where you can. Even if you're a smaller group, we get a lot of people who tend to think that brokers are good for bigger groups, right? Because I have a lot of employees. I would rather spend time focusing on my business, and that broker can kind of help me facilitate that. But it works for small groups just as much, right? Because they're going to help you kind of look at those plans, figure out what your cost structures are going to be, and they'll be able to kind of talk with you about, what happens if I grow, right? What is that going to look like across the board? And what happens if I don't have employees anymore? So there's really a lot of different things that a broker can do to help you. But there's also people here that can help you. You can call our contact center, and if you have a question or you are interested in, getting some information from us, you can ask that question, and we will do what we can on our end to kind of reach out and talk to you and find out if you need any kind of help or assistance or services. I think when it comes to shopping for healthcare, it's expensive, right? I think some of us as employers are offering it because it's the right thing to do. Some of us are offering it as a tool to, keep retention rates up, right? It's because it's an attractive offer when you're trying to get employees on if you can afford it. So we try to do everything in our power to try and give you the tools to at least, I would say, curb that cost and that burden on your end through our various programs. So, through the shopping model, just being able to compare and contrast all of the different plans allows you to kind of pick the plan that works best for you. Being able to choose a reference plan where, if I choose a tough silver plan, I know what that cost is going to be. So if a couple of my employees need to shop up for a gold plan or even shop down, my cost is going to stay the same. So sometimes those static costs allow you to understand what your payments are going to be every month, and then you're not caught off guard. Our wellness program, if you participate in our wellness program, you can get up to 15% back in a rebate check at the end of the year for the premiums that you pay towards your employees. That's a huge kind of cost savings, especially going into the new year where we know premium rates are going up. So, even if you're a new group, if you're a renewing group, it's great because maybe you can offset some of that cost adjustment. Or if you're a new group, it's a way to, hey, I was going to offer, insurance, but now rates are a little bit high and now I don't know what I'm going to do, but now maybe I can utilize that ConnectWell program to kind of help. There is two going into January if you start in November. So we did talk about how the contribution rate is at minimum 50% for the employer. Um, in January only as a shopping mechanism, and this is under ACA guidelines, that they allow this, is you can actually offer less than 50% as a contribution rate, and it's the only month in the year in which you can do that. And the reason why they do that is to allow, you know, employers who may be on the cusp that, hey, I really want to be able to offer insurance, but 50% is just, it's too much right now, right? So maybe you can be able to offer coverage and offer 30%. And then maybe that allows you to at least bring people in, keep your business going, and then at another time, you know, maybe 3 years down the line, you decide, you know what, we're well established, we're making some more money, the business is doing well. I would love to be able to offer a little bit more. I'd like to go up to 50%. So, you know, we find that January to be a high enrollment month because it allows more flexibility on your end when it comes to shopping, especially where, like I said, we know that these premiums and rates they're high right now. So it allows you to at least be able to offer these services to your employees so that everyone can get healthcare, and then do it at a way that it benefits the employee, but also benefits the employer as well.
Thank you.
Mm-hmm.
That's a helpful explanation. Um, I feel like folks have been answering questions throughout, but there may be some questions that still need to be answered, or perhaps there are themes of questions that we want to spend a little bit of time talking about. Jonathan, Eugenia, take your lead, however you want to go about this.
No, I just want to say big thank you, Nikki and Jonathan, for the wonderful presentation. We really appreciate all of the expertise that you've brought today and thinking about the needs of our educators and folks who run programs across the Commonwealth. I'm gonna stop the recording. So, okay.